2020, HUMRIX provided funding for projects to improve cancer patient experience and outcomes. Beechworth Health Service was a recipient of this funding to enhance cancer services delivery and the cancer patient experience of care in the Beechworth locality. Tonight, we have invited Liz Ibrom from Beechworth Health Service, who led the project to unify local resources to upskill for supportive cancer care and service coordination. Thanks, Liz, for joining us tonight.
Hi, my name's Liz. I'm the project lead for Beechworth Health Service. Several months ago, I was approached to do some project work regarding enhancement of cancer services for our rural health service. It was a small project and it only took a couple of months, but in that time we were able to tighten up some communication pathways between our health service, our regional health services. So Beechworth Health Service is a small rural health service that doesn't deliver chemotherapy per se, but we are capable of providing adjunct therapies such as transfusions and management of side effects. The project was based at aligning communication between the GP service, our pharmacy service and ourselves. The goal of our project was to enable patients in this region to seek treatment locally for those adjunct therapies rather than to head across to the Border Cancer Centre, hence saving their trip. And if a patient is unwell and actually spends a lot of time at the Border Cancer Centre already getting the chemotherapy treatment, so it saves them time to having to keep going back there for treatments that could be easily sorted in their local area. Their family, less travelling for their family, and just to receive a service in your local hometown, I think is it's very important. I think especially when you're unwell. And also there's a lot of activity at the Border Cancer Centre. It's a very busy centre and it sees a lot of patients. So if we can also relieve some of the flow and the burden off the cancer centre by managing our own, I think it's a twofold bonus. In able to do that, we established a charter of commitment of care to cancer services. So that involved creating partnerships with the GP service, and we were able to get a GP lead. So she was very keen and to establish pathways with the medical services at the Border Cancer Council. And she was also looking at some maybe developing some shared care plans. And we also introduced her to the optimal care pathways, which was used sporadically and not a well-known resource. They did have other resources, but she was very keen to integrate the optimal care pathways into the GP practice. So they were all practicing from the same body of evidence. And we were also integrating, making sure that our policies and procedures, especially with our advanced care planning and palliative care service, had actually aligned with those optimal care pathways as well. So also a review of the back end of our policies regarding palliative care. And I think it's important that the GPs, while they are always using evidence-based practice, to use the gold standard of the optimal care pathways, which are very thorough and I think an excellent resource and should be used throughout all services. So I was very happy that they've taken that on board and run with them. That Beechworth was increasing their services, their capabilities, especially more specifically with regards to the management of border cats, which we don't historically manage. So we had to begin some training programs here at Beechworth Health Service to enable our staff to be efficient and competent using border cats and safely and professionally. So that involved making sure our protocols and our guidelines and our policies were all up to date, which we achieved. The competencies for our registered nurses were able to be accessed, and that we had some simulation training, which is actually in progress at the moment. The registered nurses were were quite happy to upskill in Portacas for knowing that it was for their community that they service. And Beechworth Health was very eager to keep broadening their services to meet the continuing needs of the community, because the cancer rates of cancer are spread throughout the whole of Australia, and Beechworth's not immune to having a lot of clients in the community. So for the GP service to manage patients with Portacas or with side effects of their chemotherapy, they would now know that Beechworth Health Service were proficient in Portacas and that they could safely send their patients to Beechworth Health Service for their treatments and transfusions. And also the pharmacy, being a small rural town, the pharmacy and the GP and the hospital are quite connected. So if a patient was to come wander into the pharmacy and saying, I'm having a bit of trouble with my Portacap, or I'm having a few troubles with my side effects, then the pharmacy, knowing that Beechworth Health Services has now skilled up and able to provide a more broader service for people with CVAD devices. But a lot of policy review and communication. We also approached the palliative care service in Wodonga to share their pathways and their care plans with our district nursing service in Beechworth. So also sharing care plans electronically between the two services. And obviously Wodonga palliative care comes to Beechworth, but not necessarily in the same loop as the district nursing service. So we tightened up those pathways and care plans there. Also, the GPs were very keen to have palliative care come to the GP clinic. So we set up those communication pathways as well. So the project is finished now, obviously, and it did go for a short period of time. So I've left it in the hands of the GP to follow up those shared communication medical care plans with the Border Cancer Centre, and also the SIM training is in progress for Port